I'm going to explain about the anesthesia coding guidelines. Already I shared the notes right in your Skype itself. So what is mean by anesthesia and what is starting with what series? So anesthesia code start with what numerical? Anesthesia code start with what numerical?
Starts with zeros.
Start with 0. Yes, correct. 0. So this 0 series we are reporting to the only for the anesthesiologist service. So anesthesiologist giving anesthesia only, we need to give the anesthesia codes. So anesthesiologist service we are reporting the 0 series. Okay. So this one you have to know clearly. So anesthesiologist service we are reporting. From this 0 series, how many questions it will come? How many
Four.
questions?
Four. Four.
4 questions. Yes, 4 questions it will come. So what is the definition I given in that? One second. The process of injecting chemical or anesthetic agent into human body which results in loss of consciousness and sensation. The process of injecting chemical or other agent into the human body which results in loss of consciousness and sensation. That is for the anesthesia. So this is 0 series we are reporting for the anesthesiology service. Okay. Then we have the types topical, local, general, regional. Topical, local, general, regional. Top means above the skin. Anesthetic agent applied surface of the skin. Okay, that is for topical. Local means particular area. So anesthetic agent injected into the particular area. You should not feel anything. Na? That time they will keep the local. Then general means for whole body sensation not having. They want to do any major surgeries. In the time they will keep the general anesthesia. So general anesthesia for the major surgeries. Okay, top now above, local na particular area or gland. Then general means whole body sensation. Then we have regional. So under regional, spinal, epidural, nerve block. So anesthetic agent injected into the spinal canal. We have spinal cord in that they are injecting to assist with the any surgery want to perform below the upper abdomen. Any surgery want to perform below the upper abdomen, they will keep the spinal anesthesia. Okay. Then epidural mean the anesthetic agent injected into the epidural space for the to assist with the post-operative pain. Post-operative pain management. After surgery, that person should not feel any pain or sensation. In that time, they will keep the epidural anesthesia. Spinal canal they are doing to perform below the upper abdomen, it is spinal. In epidural space, injecting in that is for the epidural anesthesia. Then we have the nerve block. So anesthetic agent injected into the nerve because nerves only giving sensation, right? If you are blocking the nerve, then you will not feel any sensation. So they are blocking the nerve. We are blocking the nerve. So that is for the nerve block. So anesthetic agent directly into the around the nerve to block the sensation. That is for the nerve block. So we have the types: topical, local, general, regional. Under regional, we have spinal, epidural, nerve block. Okay. So any doubt in this types? Everyone, anyone?
Yes, sir.
See, I mentioned only types only explain. So topical mean above the skin, local mean particular area, general mean whole body sensation. Regional in that we have spinal anesthetic agent injected into the spinal canal, spinal cord to perform the below the upper abdomen any surgery. Any surgery want to perform below upper abdomen, that time they will keep the spinal. Epidural mean in that epidural space they will inject anesthetic agent to assist with the post-op pain management. Post-operative pain management. That is the epidural. Nerve block mean blocking the nose. The nose only giving sensation to the finger, palmar areas and all. Correct. That nose blocking, no, you will not feel any sensation. So that is for the nerve block. So you need to know what is mean by local, topical, general, regional. Okay. Then generally who will give anesthesia? Guys, notes and all you have already with you. While explaining, please look the notes. You downloaded or you have taken print out, right? While taking session, what types? You can go through that. So anesthesiologist only will provide the anesthesia, right? Maybe on the day anesthesiologist giving general anesthesia and additionally done some procedure additionally means, so we need to know what are all included in anesthesia, what are all not included in anesthesia. So here I given anesthesia included services. So administration of fluids, anesthesiologist given anesthesia on same day administering the fluids or blood transfusion done, which is included. And monitoring services, ECG monitor, temperature, BP, pulse oximetry, capnography, and checking mass spectrometry. These all are included. So anesthesiologist given anesthesia on same day additionally doing fluid transfusion, fluid administration or blood transfusion, it's included. ECG checking, temperature checking, BP checking, pulse oximetry checking, capnography, mass spectrometry, these all are included in anesthesia. While giving anesthesia code, 0 series code, this procedure not codable separately. Okay, clear this point. Whatever included I given. While giving 0 series code, this and all not codable separately. And included, I said not included. So anesthesiologist given anesthesia, additionally doing some other procedure means, so whatever procedure listed, intraarterial line or catheter, central venous or catheter, Swan Gons, this procedure is not included in anesthesia. So while giving anesthesia code 0 series, this procedure not codable because, not, we need to code separate because it's not included. So 0 series code and 36620 or 25. 0 series code and 3655 or 36556. Then 0 series code, then Swan Gons additionally 93503. These all are not included. Not included means you need to code separately. Please go through that. Not included code sets. Not included things. Please go through that. And based on that, I given below one question. Which of the following not included in anesthesia service?
CVAP to 4 years old patient.
Okay, good. Which of the following not included? So in that ECG, EKG included, and capnography, BP included, CVAP alone not included. Okay. So which of the following not included means I said whatever included. So not included is CVAP. Is that correct? Everyone clear?
Yes, sir.
So you can tell whatever not included, that quotes alone you can give, you can type whatever services not included. What are services not included? Guys, please tell the what are all not included procedures. That CPT if you are giving, it's good. Quickly you can give. So not included, I given in class note also. So intra-arterial line 3662025, central venous catheter 36555 36556, and Swan Gons 93503. Intra-arterial line catheter 3662025, central venous 36555 36556, Swan Gons 93503. These all are not included. Okay, everyone take the book starting of the uh, anesthesia coding guidelines. What page number it's starting? Anesthesia coding guidelines starting what page number?
Page number 60.
Okay, okay, you can go there in that second paragraph from bottom to fourth line. You are reading, you will come to know what are all included, not included items. Guys, that no CPT book, please anyone share in the Skype, because I'm not able to see download that. I shared it from different account. Anyone having, you can forward it, that book. Please share anyone. I think everyone is having, right? Please share once again in the group. Thank you, Krishna Raj. Okay, page number 60, right? Book page number 60, we have the anesthesia coding, anesthesia guidelines. In that second paragraph, mention clearly what are all not included. So administration of fluids under blood, usual monitoring ECG, temperature, blood pressure, oximetry, capnography, mass spectrometry, and all included. Not included is intraarterial, central line, swan gons. So you need to know whatever included, not included. Okay. Okay. And we'll use the modifier along with the 0 series. We'll use two modifier. First modifier I'm explaining 23. So 23 modifier, what description is present? So modifiers, yesterday we discussed symbols, right? In that page only we have the modifiers also. Starting, cover page, back we have, right? So what is the description of the 23 modifier? 23 what given? Unusual anesthesia. So unusual anesthesia. So one thing, you having the severe headache, you are visiting to the hospital, MD examine, MD planning to perform the CT of the head. Now CT of the head is ordered. Okay. Okay. So unusual anesthesia, you need to use modifier 23. So I said for the want to having severe headache, you are visiting to the hospital. To perform the CT of the head, we need any general anesthesia or any anesthesia needed, or we can go directly and take. to perform the CT of the head. To perform the CT of the head, any anesthesia needed or not? Want to perform the CT of the head, any anesthesia needed or not?
Not needed.
No need, correct? Yes, no needed there. But mentally ill, psychiatric patient, parents only bringing that patient into the hospital. Parents only bringing that patient into the hospital. In that time, MD planning to order the perform the CT of the head to the mentally ill psychiatric patient. Now you can tell want to perform the CT of the head to the mentally ill psychiatric patient. Need anesthesia or not? Can go directly. Any anesthesia need or not?
Anesthesia may require depend upon the patient condition.
Now in this scenario you want or not?
Yes, sir.
Why you want?
Needed.
Sir, it's mentally ill patient, and if we want the clean image of the radiology services, the patient must be cool and calm.
Oh, wow, good. Yes. So maybe in outside he is calm. Once he went inside, he is breaking or hitting something, then it is problem, right? So to prevent that, usually want to perform the CT of the head, no need anesthesia due to the unusual, unavoidable situation, which is done under general anesthesia. So in that scenario, you need to use modifier 23. See, used to report procedure which normally requires either local or no anesthesia. Local or no anesthesia must be done under general anesthesia due to unusual circumstances. Due to unusual circumstances. So this modifier 23 have to append with only 0 series. Please remember this 23 modifier have to append with only 0 series. We are seeing with some other codes 50500 23 and 00560 23. Like that, two option given, A and B given. Now what is the answer?
Answer B.
50500 23 and 00560 23.
005623.
Guys, what happened? Others. So I said 23 modifier how to use with only 0 series. So only 0 series, your answer is 00560 23 modifier. 00 560 23 modifier. That is the correct. Okay. Everyone clear with 23 modifier?
Yes, sir.
Okay. And 47 modifier. Anesthesia by surgeon. Modifier description is anesthesia by surgeon. Generally, anesthesiologist only will provide the anesthesia to the patient. On the day, anesthesiologist not present, not available, absent. In that scenario, who is going to perform the procedure? That surgeon. Surgeon giving general anesthesia and performing procedure. Surgeon giving general anesthesia and performing procedure. So surgeon is doing anesthesia plus surgery. Correct. So surgeon doing general anesthesia and surgery. In that time, you can use modifier 47. So modifier 47 have to give with surgery codes. 47 modifier have to append with only surgery codes. So 47 modifier have to append with only surgery codes because surgeon only involving, no anesthesiologist. Anesthesiologist involved only 0 series. Otherwise, if surgeon involving, you can give 0 series code. So 0 series code, sorry, 1 to surgery codes with 47. If surgeon involving, anesthesiologist involving 0 series. Okay, so 23 modifier have to append with 0 series. 47 modifier have to append with surgery codes. Please make the note of this. Okay, which of the below one is correct?
Option C. Option C.
Okay, so which of the following below one is correct? So 0 series 47 wrong, 5 series 23 wrong, and 1 series 23 wrong. So correct one is 0056 to 23 modifier. That is the correct.
Sir,
Yes, yes.
yes. 47 modifier will never go with 0 series.
47.
Yes.
No, 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 no. You are giving that there is wrong. Okay, clear. Then we have for the anesthesia time reporting in inside the book. While checking page number 60, book page number 60, we have anesthesia time reporting. I'm saying surgeon is giving, anesthesiologist not present. In that time, surgeon giving general anesthesia and performing procedure mean you have to use modifier 47. He will document both done by same doctor, same surgeon. In the time you can go with that. Okay, here time reporting. Time of the anesthesia procedures may be reported as customary in the local area. Anesthesia time begins. Anesthesia time begins when the anesthesiologist begins to prepare the patient to give anesthesia. Anesthesia time begins when the anesthesiologist begins to prepare the patient. Okay, patient came. Anesthesiologist coming to prepare the anesthesia to give anesthesia purpose. The anesthesiologist preparing the patient. That is the start time. Then surgery started, surgery over. After that, that patient moved into the another room. That patient moved into the another room for post-op supervision. That is the end time. Okay, in between how many hours, how many minutes when you need to calculate for the anesthesia. In between how many minutes, how many hours it went, you need to calculate. So that is for the anesthesia time reporting. Please go through the anesthesia time reporting and take the notes. I will give one example. Please quickly take. Okay. So in that related, I'm giving one question. So anesthesiologist prepare the patient to give the anesthesia. Please tell the answer for this. Everyone tell. Guys, give the answer quickly. Others, but 4 people only given. What about others? So, anesthesiologist to prepare the patient to give the anesthesia at 9 o'clock. Surgery started 9:15. Correct. Surgery end at 9:45. Then patient moved into the recovery room for post-op supervision 10 o'clock. So 9 to 10, 1 hour. That is the anesthesia time. Okay, everyone clear? Any doubts? Anyone? Okay. So next, we have physical status modifier. Anesthesia physical status modifiers. So this modifiers can use along with the 0 series only. Okay. P1 to P6 modifiers we need to use with the only 0 series. So P1, P2, P3, P4, P5, P6. P1 is there at the time of administering anesthesia. Patient is healthy, a normal healthy patient. A normal healthy patient, that is for P1. P2 is a patient with mild systemic disease. A patient with mild systemic disease. That chronic condition, lifelong conditions. Today status is mild control stable. Mild control stable now can go with the P2. A patient with mild systemic disease. Then P3, a patient with severe systemic disease, that chronic condition, hypertension, DM, COPD, asthma, hyperlipidemia, that chronic condition, today's status is severe, worsening, uncontrolled. Then you have to come with the P3 modifier. Okay. So hypertension, uncontrolled, severe DM. This is all considered severe systemic disease. If that chronic condition status, if it is controlled mild, then you can go with the P2. Okay, if it is worsening, then if it is P3. Then life threatening condition. P4 is life threatening condition. P4 is life threatening condition. You have to use modifier P4, life threatening condition. Okay, so all fail is considered P4. Then moribund patient who is not expected to survive without the operation. We need to do surgery immediately, then only patient live, otherwise he will die. That patient called moribund patient who is not expected to survive without the operation. That is for P5 modifier. who is not expected to survive without the operation. That is for moribund. Then P6, brain dead patient. Brain dead patient for taking the organs, donor purpose, doing the anesthesia means then P6. Yeah, P1 is normal healthy patient. P2 is patient with mild systemic disease. P3 is severe systemic disease. P4 life-threatening condition. P5 moribund patient. P6 brain dead patient. This P1 to P6 modifiers you have to give with the only 0 series. Only 0 series, only you need to give. Only 0 series only you need to give. And after that you have to give the whatever modifier. Okay. Everyone clear this P1 to P6 modifiers? Okay. So next we have for qualifying circumstances. So qualifying circumstances means these all are add-on codes. This add-on codes you need to give along with the 0 series code. First you have to give 0 series code and this code additionally. Okay. So 99100, 99116, 99135, 99140. 99100, 99116, 99135, 99140. These all are add-on codes. These add-on codes you need to give along with 0 series primary code. First 0 series code and this code additionally you have to give. Only for anesthesia codes, not for other codes. This code you need to append with only 0 series, not for others. Okay. And at the time of administering anesthesia, patient age is less than 1 year or greater than 70 years. At the time of administering anesthesia, patient age is younger than 1 year, less than 1 year, or greater than 70 years, older than 70 years. Less than 1 year or older than 70 years, you need to give 99100 additionally. Age is less than 1 year, above 70 years, you have to give additional 99100. Okay. At the time of administering anesthesia, patient having low temperature, hypothermia. Patient having low temperature mean hypothermia. You need to give 99116. Then at the time of administering anesthesia, patient having low BP, blood pressure, low BP means hypotension, 99135. Low temperature, 99116. Low BP, 99135. Emergency condition treated in delayed. Emergency condition treated in delayed, 99140. Emergency condition treated in delayed. That means one motor vehicle collision happened. That time patient got multiple injury laceration, but patient not went immediately to the hospital. Maybe patient going after 2 days, 3 days, that wound and all become inflamed, infected. Correct. That time they want to treat for that particular wound. They are giving anesthesia means you need to use the code 99140. Anesthesia complicated by emergency conditions. So less than 1 year, above 70 years, 99100. Low temperature, 99116. Low blood pressure, 99135. Emergency condition treated in delayed, you need to use 99140. Okay. So this add-on codes you need to give along with the 0 series primary code. First 0 series and this code.
பேஷண்ட் ஏஜ் வந்து 1 இயர் பிலோ இருந்தாவே அனஸ்தீசியா கோடு கூட இந்த கோட் ஆட் ஆனா கொடுத்துடணுமா சார்?
Yes, yes, yes.
மாடிஃபையர்ஸ் மாதிரி இந்த கோடு எல்லாமே யூஸ் பண்ணணும்.
What?
லைக் மாடிஃபையர்ஸ் மாதிரி இந்த கோடும் வந்துட்டு கிரைட்டீரியா பொறுத்து கொடுத்துடணுமா?
Modifiers, how we are giving modifiers, similarly we need to give this additional code also. So emergency conditions, I said now only one motor vehicle collision happened. That time patient got multiple injury lacerations, but on the day of injury not went to the hospital. After 2 days, that person going now, that wound, how it is? It is become more inflamed, infected, maybe lost to the some particular part also, right? So in that time they are giving anesthesia to solve that problems. That time you have to go with 99140. They're coming for treatment in delayed. I will tell. We have the papers, right? In that everything we have. Okay. Emergency condition treated in delayed. They will tell this is condition taken treatment delayed. That time you can go with 99140. Okay. So while coming with the anesthesia concept, we need to know this theoretical part and modifiers, physical status, and qualifying circumstances. Apart from this, we have some other modifiers also. AA to QZ modifiers. We have this modifiers can use from the EPICS book, HCPCS book. Please go through this modifiers AA to QZ. AA to QZ modifiers. Once glance you can look, I will explain. Yeah, if warrant 4 cases, you can give 4 codes separately. 99100, 99116, or 135, 140. You can give. Okay. So anesthesia personally performed by anesthesiologist. Anesthesia personally performed by anesthesiologist. What modifier? Anesthesia personally performed by anesthesiologist.
AA modifies.
23.
AA, correct. Anesthesia personally performed by anesthesiologist. AA modifier. Then physician,
பெர்ஃபார்ம்டு பர்சனல் என்ன புரியல எக்ஸ்பிளைன் பண்ண.
they have to tell clearly anesthesiologist only done, not any other person. They will document clearly I only performed. Sometimes the common word they're telling now, we need to query that. Okay, modifier want to use, they have to tell the document clearly personally performed. Maybe anesthesia assistant also sometime they will do. That is maybe supervised or not, we don't know, right? So that he only given by own. Then they have to document personally performed anesthesiologist. Down mentioned one physician having the 5 assistants giving anesthesia to the patients at a time, that is supervised by the doctor. So then what modifier? 5 people are having assistants, that assistants giving anesthesia to the patient for different cases at a time, doctor doing supervision.
AD.
AD, sir.
Yes, medical supervision by more than 4 concurrent anesthesia procedures. More than 4 concurrent anesthesia procedures. That is for AD. If 2, 3, 4 cases, medical direction of 2, 3, 4 concurrent anesthesia procedures.
QK modifier, sir.
Q, K modifier.
K modifier.
Yes. So only monitored anesthesia care mention, MAC mention. Only monitored anesthesia care. Only
QS.
monitored anesthesia care.
Hello.
Yes, yes.
Sir, what is difference between AD and QK then?
See, AD is there, they are doing supervision more than 4. That means 5 or more.
Okay.
Ah.
Thank you.
Only monitored anesthesia care mention MAC QS. Okay, MAC for deep complex invasive procedure. MAC for deep complex invasive procedure. MAC for deep complex invasive procedure. What modifier? MAC for deep complex invasive procedure.
G8.
G8. Yes. MAC for severe cardiopulmonary condition. MAC for severe
G9,
cardiopulmonary condition.
G9.
G9, sir.
G9. Yes. Resident giving anesthesia under teaching physician supervision.
GC.
Resident given anesthesia under teaching physician supervision.
GC, sir.
GC. Okay. So only MAC QS, MAC for deep complex G8, severe cardiopulmonary condition G9, resident given anesthesia GC. And CRNA, certified registered nurse anesthetist giving anesthesia under the physician. CRNA giving anesthesia medically directed by physician. What modifier? CRNA given anesthesia medically directed by physician.
QX modifier, sir.
sir.
QX. Correct. So CRNA giving anesthesia directed by physician in one case. CRNA giving anesthesia directed by anesthesiologist in one case.
QY.
CRNA giving anesthesia directed by anesthesiologist one case, no? QY. Yes, correct. CRNA giving anesthesia but without supervision.
QZ.
QZ.
CRNA giving anesthesia without supervision. QZ. Okay. So this AA2QZ modifier, it is EPICS modifier. This present in your EPICS book. This modifier can use along with the 0 series. AA2QZ modifiers can use with the 0 series.
0 series only, right, sir?
Yeah, 0 series only. Okay, so we explained the theoretical part. We have the code selection.
Hello.
Yes.
Sir, would you please explain QI once again? QI.
QI. So CRNA giving anesthesia directed, supervised by, they are telling anesthesiologist. Mention physician QX. Anesthesiologist mention QY. Anesthesiologist. Physician mention QX. Anesthesiologist mention QY.
Okay, thank you.
So remaining we have maybe 10 to 15 minute explanation and examples and all. Maybe you can try 1 second. I will show that. How to take the codes mean. Any anesthesia code want to search, you need to go with your book backside of the alphabetical index. Backside of the alphabetical index and try under anesthesia. You need to try. Once again I will show that. Maybe you will take the answer in your home. I will tell how to take. 1 second. What is the page of the anesthesia index page number? Once again. So you want to take the code, anesthesia code, you can go with your book, anesthesia under, you can look what procedure, anesthesia for what, if it is abortion or anything, chest procedure or CAPG procedure, or like that only you need to search. Anesthesia under what procedure. So here we have, right? So anesthesia. So anesthesia under abortion incomplete. So anesthesia under abortion, if incomplete mean what is the answer? Anesthesia under abortion incomplete. So everything you have to search in the anesthesia down only. Anesthesia down only you need to take. Don't go directly the procedure name. Don't go with the directly procedure name. You can go with the anesthesia under what procedure. You are not getting procedure name, you can go by the anatomical site. Anesthesia under heart or like that. Okay. So like that only we need to take. Okay, that is for the first one. Then you need to take for the physical status. So first 0 series code. Then physical status modifier. Then HCPCS modifier. Then qualifying circumstances, then time. Okay, so you need to give the, first you have to give the 0 series code. Please remember 0 series code first, then physical status modifier, then EPICS modifier, then qualifying circumstances, then time. 0 series, physical status, EPICS modifier, qualifying circumstances, time. Okay, this is the concept you need to follow. Okay, so based on that I given examples. Okay, so I given examples here.
Sir,
Yes, yes.
again tell me again. 0 series, second is physical status modifiers, third one is fixed, fourth one is qualifying circumstances, extra.
Time, anesthesia time.
Okay, thank you, sir.
So 1 and 2 question I given. First question you can take for only time. Second question you can take for all code everything, and another 1 and 2 0 series code and modify anything is warrant. So please take the answers, that all will discuss in the tomorrow. But before starting the session you need to submit your answers, then I will give explanation. Okay guys, this much only for today.